All right, so our project or topic is arthritis. Our patient is an 80-year-old female who has arthritis in both knees, has a total knee in her right knee. She lives with her husband and her dogs and has children and grandchildren nearby. She also has a past medical history of hypertension. Her signs and symptoms are anterior lateral knee pain, swelling, stiffness, limited knee flexion, range of motion, and pain that does not go away with exercise. Currently limited in walking with her dog and moving in general due to pain and stiffness, and still wants to be able to do her arts and crafts without pain. She lives in Scottsdale with her husband in their own home. It's a single story with no upstairs. She lives with her husband and her kids are nearby. She has a small dog. Attends art and craft group sessions 3 times a week, hikes once a week, and goes for walks 2 times a day. She doesn't want any jumping or running exercises, wants to stay close to home, and wants to be able to knit without pain. Her desired intensity for exercise is moderate, and she doesn't need medical clearance prior to starting this exercise program.
Rationales for the exercise is exercising such as range of motion and strengthening and aerobic conditioning have a strong correlation with an improvement in deficits seen in the patients. The changes are small and evidence is minimal. However, the exercise is shown to reduce pain and stiffness, increase muscle strength, improve endurance and cardiovascular fitness, help sustain independent living and functioning for older patients. So potential providers could be a personal trainer. However, they may be limited in their knowledge about the condition, but they can be more affordable for some populations that don't have the insurance coverage for a physical therapist. And for a physical therapist, they do provide that more specialized care. This can be done in individual and group training. For individual, it is more specialized and they can go at their own pace. In group training, it allows for a community support group as well as more motivation for the patients.
Some places where the patient could exercise would be at home, at a fitness center, or at an outpatient clinic. At home, she would be in the comfort of her own home. The exercise would be quick and easy. At a fitness center would be where she focuses mainly on her aerobics and resistance exercise, and outpatient would be checking up on the exercise regimen with her therapist. Some materials here would be aerobic exercise such as walking and maybe water aerobics, yoga, which would help open up the chest and teaches proper breathing, and resistance training to help promote independent living.
So procedure for aerobic training, we want to improve her cardiorespiratory endurance without increasing joint pain, and we do this by encouraging movement throughout the day to decrease the sedentary lifestyle. Some examples are indoor cycling classes, aquatic exercise classes, and chair cardio. And for resistance training, we would want to increase her muscular strength, endurance, and function, and this is gained through progression. Arthritis patients should be increased resistance loads slowly and in small amounts. Some examples are machines, free weights, resistance bands, and bodyweight exercises, and we would just talk with her to see which one she wants to do the best.
So for the frequency of the exercises, for aerobic, we would want her to be doing aerobic exercises 3 to 5 days a week, accumulate at least 150 minutes per week of moderate exercise or 75 minutes per week of vigorous intensity aerobic exercise. For resistance, we want her to be practicing at least 2 to 3 days a week, going at 60 to 80% 1RM, and then we want to include all major muscle groups. For flexibility, we want her to be practicing this at least 2 to 3 days a week with 30 to 60 minutes per session.
The total duration of the program, we would like to see Cheryl at PT for 4 to 6 weeks, 2 times a week to manage symptoms, increase mobility, and improve physical function. Cheryl should continue exercising on her own long-term and revisit PT as needed to maintain health benefits. Some considerations for arthritis during PT sessions we want to address is swelling, pain, joint mobility, and joint forces.
So the duration and intensity of each session, we want to see her for in PT for 6 weeks, 2 times per week. For intensity, she'd be working at 40 to 50% of VO2 rest for aerobic training. Flexibility training should be performed every day through various different types, focusing on the affected joints and then the surrounding muscles and whole body. Resistance training should start with an intensity of 50% of the 1 rep max and work up to 60 to 80% gradually. Specific considerations for our patient is that she does have the previous knee replacement, and she also has a diagnosis of hypertension. Other considerations are progressing these exercises, which can come from increasing time or increasing loads or increasing the range of which we work through. Communication with healthcare providers could be primary care for any changes in her medications or new symptoms, and possibly an orthotist if it's deemed that the patient could benefit from things like orthotics to help with gait and reduce knee pain. Contraindications are to avoid exercising intensely during flare-ups. You can focus more on gentle stretching and small bouts during those. Education is important to make sure that this patient understands that physical activity is safe and it's great for decreasing pain, fatigue, inflammation, and disease activity.